Yep. Good afternoon, everyone. My name is Alex Regan. I am the Legislative Director for the New York State Association of Counties. We appreciate all of you joining us on short notice for this very important webinar about the Rural Community Health Integration Opportunity. This is a grant opportunity that we know many of your local health departments are already engaged in, and we're hoping to provide you with more information about the grant, as well as more information about assistance that is available to help with your application and ways to submit a strong application on behalf of your county. I want to turn it over to our Executive Director, Stephen Aquario, to kick us off and provide more detail about why we're offering this webinar today.
Okay, Alex, thank you very much. And thanks again to all the county officials who are taking the time to join this very important rural health, community health webinar. Like rural issues for our rural counties at every opportunity that we can. My name is Stephen Aquario. As Alex mentioned, I'm the Executive Director, and I'm pleased to welcome you today to this webinar on Rural Community Health Integration, a Grant Opportunity. And NYSAC and the New York State Association of County Health Officials, NYSHO, are hosting this webinar today because we know how important rural healthcare is for rural New York. And we know how challenging it can be for our rural counties, for our local health departments, hospitals, EMS providers, and behavioral health providers to build and sustain the needs that are necessary in these types of communities. In many rural communities, the issue is not simply whether care exists, it's whether residents can get the right care at the right time in the right place. It's whether a patient can be discharged from a hospital with supports that they need to cover them safely at home. It's whether preventative care, behavioral health, substance abuse treatment, maternal health services, EMS, long-term care, and social supports are connected in a way that works for the people that we serve. That's why this opportunity matters. The Rural Community Health Integration Initiative is designed to support coordinated rural health partnerships, improve care coordination, expand access across care continuums, and address both health and social needs. It recognizes what counties have known, that rural healthcare cannot be strengthened in simple silos. It requires collaboration amongst hospitals, county public health departments, EMS, behavioral health providers, community organizations, and other local partners. And that's exactly where counties can play such an important and critical role. Counties are the conveners. Counties understand local needs. Counties see where the gaps are in transportation, in workforce, in behavioral health, emergency response, aging, public health, and social services. And in rural communities, especially, counties are often entirely best positioned to bring partners together around a shared plan. And I had the privilege and pleasure, along with Alex, to see that firsthand in Allegheny County, New York last week. NYSAC's role is to make sure and NYSHO's role is to make sure our rural counties know about opportunities like this, how they can understand how they can participate, how they can have access to the information and technical assistance they need to be competitive. We want to help counties not only respond to this funding opportunity, but to use it strategically to build partnerships and models of care that can be sustained over time. Let me be clear. This is a significant opportunity, but the timeline is short. And that's why Sarah Ravenhall and I at NYSAC joined together with the Public Consulting Group, which will help walk you all through this grant opportunity, eligibility, application requirements, and the types of projects that may be supported. Our goal today collectively is straightforward: to make sure our rural counties and their partners have the information they need to evaluate this opportunity very quickly, identify potential partners, and move towards a strong application. We'll leave time at the end for your questions, although throughout this presentation, please submit your questions directly into the chat line. We'll either answer them in real time or make sure to take them up at the end of the presentation. I really want to thank and express my sincere appreciation to Sarah Ravenhall from NYSAC, our long-standing partner in working together to address all things in public health. I want to thank her colleagues that are here with us today and thank NYSAC for their partnership in preparing the counties to take advantage of this opportunity. I know how busy Sarah is. I'm grateful that she took the time to participate with NYSAC and to serve you all. So before I turn to our partners at PCG, I'd like to have Sarah Ravenhall, the Executive Director of NYSAC, say a few words.
Thank you so much, Stephen, and thank you to NYSAC for your partnership and leadership in bringing attention to this important opportunity. We especially appreciate NYSAC's commitment to ensuring that local health departments have a meaningful role in the rural health transformation efforts taking place in New York State. Public health is an essential partner in building healthier, more resilient communities, and we're grateful that this funding opportunity recognizes the value local health departments bring in prevention, care coordination, and community partnerships. We look forward to continuing to work together to strengthen rural health across New York State. Back to you, Stephen.
Okay, and Sarah, thank you again for the wonderful partnership that we have. Before I introduce our speakers, I want to thank Governor Kathy Hochul, a terrific governor who's been serving and representing counties and helping us with public health funding, the New York State Legislature, and Commissioner McDonald at the New York State Department of Health for their role in promoting and protecting rural health. So without further ado, let me introduce Alyssa Narode and Brian Carnes from PCG, and I'll turn it over to you. Thank you so much for joining us today. Alyssa.
Perfect. Thank you so much. And thank you again to Stephen and Sarah for hosting us. Hopefully we can clear up any questions or maybe there's additional clarifications you all are looking for as part of this rural health grant opportunity. My name is Alyssa Narode. I'm an associate manager here at Public Consulting Group. I also am a local New Yorker, a Schenectady County resident. And I used to work for the New York State Assembly Ways and Means Committee for 4 years prior to assuming my role here at PCG. And so I was really excited to be able to present this opportunity too, just given my local presence in New York. And I'm joined by my colleague, Brian Carnes, who's going to be speaking midway through the presentation today. So a little bit about Public Consulting Group. We have a really long presence in New York State, have worked with the Department of Health as well as NYSOFA, some of the other OA agencies on a variety of different projects. So the main thing that our company focuses on is supporting state and local agencies in a variety of different things. Specifically, why we wanted to help present on this opportunity is a lot of the things that Brian and I focus on is within the EMS space. So we work with over 550 local fire and EMS departments, as well as at the statewide level in Massachusetts, Wisconsin, Colorado, and Michigan to help bring additional funding to the EMS space. So we work on rate setting projects, we work on Medicaid cost reporting, Medicare cost reporting, so in a variety of different spaces. We also worked on the New York Delivery System Reform Incentive Program, or experience in this space as well. And so part of that one big beautiful bill that passed last year was to award $50 billion over 10 years to the states within the United States. So New York applied for funding in that first year and was awarded roughly $212 million. Part of that is to get at this rural health community integration project. And so we're going to get into that further. But the biggest thing too is that this was just for budget period 1. That $50 billion expands over the next 5 years. And so, I think what's probably going to be really important for New York is to make sure, one, they expend this $212 million across this first budget period, and then reapply it in future years for additional funding. So the main areas that the state is focusing on in this year 1 is to improve that healthcare access, quality, and outcomes within the counties at the rural health level. And so innovation, strategic partnerships, infrastructure development, workforce investment are the main priorities of this grant. And so with that, they released a application on June 11th. Questions were due June 18th. As of this morning, the answers to the questions haven't been posted yet, but still monitoring that. Originally, I think the applications were due July 8th. That was updated on Friday on the website. They now say July 14th. So keep in mind, they did extend it by almost a week from the original due date. And the amount that's eligible or awarded for the counties to apply to with their partners is 76.1 million. So there's a lot of money there. And we're going to get into just the amounts that are allowable. But the contract start date is going to be September 1st of 2026, with it being June 30th. So what the state is going to be looking for in those applications is how you're going to achieve your goals with that timeline of trying to make sure everything is completed in that year one by June 30th, 2027. Okay, so the purpose of the rural community health integration is first and foremost, establish coordinated rural health partnerships. So they're really looking, and we'll get into this, like who the partners are, who has to be a lead applicant, but really partnering with the providers and your partners in the community to improve care coordination, improve access to care, address the social needs and health of your community, and then improve financial sustainability through that collaboration. So what they're looking for, and these are the three key expected results, but you have to address at least one in your application, is increase access to the right care at the right time. So reduce potentially preventable ER visits. So identifying those people that might utilize the ER frequently and determine, can we get care coordinated for those individuals and see if we can provide the right care at the right time to hopefully avoid the ER when it's not necessary. The second key expected result is decreased readmissions through discharge planning and post-acute supports. So this is where that care coordination really comes into play, and trying to decrease at the hospital level, like looking through all the data, those unplanned readmissions. And then third, increase preventive care across primary and specialty care. So the application called out colorectal screening, but I think anything else as well that you want to focus on could be included as part of your narrative when you're applying for these funds. So like I said, the application, these are the three they're expecting, but you have to at least address one in this year one. And so with this, who can apply? So and we're going to get into the 47 counties that are eligible as well. But there has to be a lead applicant and then partner organizations. And as a lead applicant or a partner organization, it has to be at least one general hospital or rural emergency hospital. The lead applicants, these have to be, we didn't call out exactly all the needs of what the lead applicant has to be, but they have to be a strong institution that, can demonstrate that they have the deep community ties, have a record of demonstrated commitment to serving the constituents. I would not be surprised if all of you have those already. And so I think it's just making sure you identify who that lead applicant wants to be. And like I said, the hospital or the rural emergency hospital has to be either the lead applicant or the partner organization as you're building out your application. And so for eligibility, they have to be a registered not-for-profit organization or a municipal county-based hospital, must have 3 years of regulatory compliance history, must be located in an eligible rural county, like I said, has to be at least one hospital has to be included as either the lead applicant or a partner organization. And then these funded projects have to be completed by June 30th. So It sounds like a lot of you have already had these ideas of like what you're going to try and achieve in this first year. But thinking about that, just given that, you know, they really need to see those eligible results because the funds have to be expended by like this federal fiscal year that's upcoming. Okay, and so other lead eligibility and requirements that they called out that we want to make sure you all know about in the application. So who's eligible as a lead applicant or a partner are the local health departments, the hospital emergency, rural emergency hospitals, FQHCs, behavioral health clinics, rural health networks, primary care and specialty practices, your EMS partners, as well as long-term care, hospice, and palliative care providers. Geographic requirements, that's based on the unit or population. You have to be a county level. Geography is required. Multi-county applications are permitted, but the biggest thing that they called out in the application is that if you're applying as a multi-county, then you have to keep in mind when we get to the funding requirements, that because they allow you to do a certain amount to do your assessment or your implementation plan, they're not going to grant separate awards for that. So like if it's you're applying as a multi-county, you would just apply for one implementation plan if you're planning to do so. And then here's the eligible counties. So 47 counties are eligible. Again, this is based on the population requirements, but this was also listed out in the application. So if you're on here, you are eligible to participate. And then I think here is where I'm going to kick it over to my colleague Brian to just go over the planning scope and activities and what's, as we know right now, what's allowable and unallowable as part of the grant, as he listened into the department's presentation last week. So I'll kick it over to you, Brian.
Thanks, Alyssa. Yes, and if you haven't looked at that webinar that they put on, please do. It was very informative. I will reiterate some of the things they talked about here, but it's valuable to hear it directly from them as well. So let's talk about planning dollars. Each county may receive up to $500,000 for this planning section. These funds are meant to build the foundation for an integrated health network. You'll hear that integrated word more and more. This grant is hoping that you collaborate with those in your county and provide core planning activities, including community engagement, community needs assessment, feasibility studies, developing a governance structure, building partnerships, producing an implementation ready plan, things that maybe your health departments or your county governments have already started or may have already done in the past, but the planning can also extend for this grant into clinical workflow design or financial modeling, planning for technology integration, care coordination, things like population health improvement, and workforce development. So maybe some areas that are new to your county local health department or county. One important rule, only one planning application per county. Like Alyssa said, if multiple applicants come from the same county, the application says that they'll either be asked to collaborate or awards could be reduced accordingly. Like I said, many of these planning activities, needs assessments and such have already been done by your department, but this makes it a natural entry point and provides your county with some experience for this application. And remember that collaboration within your county is key and an expectation of all applicants. Next slide, please. Beyond planning funds, applicants can also submit up to 3 implementation projects for budget period 1. The total implementation budget across all projects cannot exceed that $3 million, but every project must be completed by June 30th of 2027 and fully vouchered by July 31st of 2027. Anything that can't be is out of scope for this period. In your request, you should explain how the funding advances the Rural Health Transformation Plan goals. how the project engages the community, what achievable outcomes each activity will produce, and how you'll sustain the work after implementation. These projects should be transformative and lay the groundwork for future iterations of the program. We don't know what additional funds will be available as the federal government assesses the goals that this first round accomplishes. Although future funding may be released at some point, the federal dollars will eventually come to an end, and your program should strive to be sustainable at that point. Remember to note that the priority areas such as applications addressing maternity, maternal and child health, behavioral health integration, and substance use disorder prevention, those will be given priority for this application. If your county is ready to act, an implementation project could fund work tied to your priorities, especially in the priority area, in those same priority areas, the maternal and child health, behavioral health, and substance use disorder prevention, which are core public health concerns. So just keep in mind that the June 30th, 2027 completion and the July 31st, 2027 voucher deadlines do still apply. Next slide, please. So here we have 6 examples that the application gives us to show the kind of activities that implementation funding could support. It's not an exhaustive list, but they do move in sort of a logical sequence that most public health professionals should probably recognize. This order should look familiar. It assesses current needs using relevant data, assessing community capacity, identifying gaps in service delivery, developing programs to meet those needs, identifying the work partners and providers to deliver them, and identifying the resources required to implement it. Strong proposals tend to walk through this kind of evidence-based progression with baseline measures and clear targets for improvement. For county health departments, you may be positioned to accomplish many of these on your own, but you should remember that the expectation is to lean on your community partners to assist in the assessment steps, gauge community need, capacity building, and service gaps using data that you likely already collect. Next slide, please. So on allowable costs, the guiding principle is that the Rural Health Transformation Program funds support new or expanded activities only. If you're expanding an existing program, the funds will only apply to the new population or new activities, and the original program keeps its current funding. Within that, allowable categories include collaboration and integration, appropriate care availability, behavioral health access, minor renovations with prior approval, of course, consumer technology solutions, EMS collaboration, information technology advances, maternal health and maternity services, prevention and chronic disease management, and training and technical assistance. So keep in mind that budgets are deliverable based, so you're reimbursed only after the deliverables are met and the accompanying expenditures and progress reports are submitted. Think about which allowable categories may match your initiatives, such as prevention and chronic disease management, maybe, or behavioral health access. Often county health departments are already doing some of this work, but because funds support only new or expanded work, you need to be ready to show that your piece adds to, rather than replaces, existing public health funding. Next slide, please. So the ineligible expenses are just as good to know here. And in the webinar that the state put on, they gave a pretty exhaustive list of all of those, maybe more than we're going to discuss here. But ineligible expenses include administrative, direct, and indirect costs above that 5% limit for budget period 1, pre-award costs, supplanting existing state, local, tribal, or private funding. That's where the existing work you're doing is ineligible. You can't replace the funding that you already have for this work, but new and expanded work is eligible. Construction, major building expansions, and demolition, direct healthcare service payments, non-allowable. Clinician salaries tied to non-compete agreements, meals, except those allowable as part of travel, of course. Lobbying and political contributions, unallowable. and ongoing operating expenses with no real path to sustainability. That's kind of, we talked about having a sustainability plan so that these programs can continue once the funding ends. The list also includes covered telecommunications and surveillance equipment, bad debts, independent research, EMR systems where a certified system is already in place. Please review the cost rules carefully and maybe listen to that webinar before you build your budget. Again, be especially careful about supplanting funding for existing funding that's already in place for these types of programming. Next slide, please. Outcomes and metrics. Applicants should probably spell out the specific outcomes that they'll achieve and the metrics that they're going to use to achieve those goals. The guidance offers some examples across several domains here. Integration, though stronger provider partnerships. Sorry, access such as reduced travel times and new community-based screening points. Quality like lower readmission rates and improved maternal child health. Financial, including better operating margins and reduced uncompensated care. Workforce, such as improved clinician to resident ratios and lower vacancy rates, and technology, like expanded telehealth use and admissions and readmissions, benchmarked against county level baselines. Next slide, please. So if you are funded, here's what's expected. All grantees participate in statewide learning collaboratives, meeting in person and virtually to share insights, best practices, challenges, and to work through strategic planning and evaluation. You'll also work directly with the department staff to finalize your contract. On reporting, specific guidelines and metrics come with contract development, and the metrics may evolve over time based on grantee work, ongoing findings, and additional CMS requirements. Budget period 1 recipients have to show demonstrable progress towards their targets through reporting by June 30th, 2027. Contracts must also be executed by October 30th of 2026, so be ready to move fairly quickly once those awards are made. Next slide, please. So here's how applications are reviewed and submitted. Selections based on eligibility, the merit of the proposed project, and how well the activities align with the Rural Health Transformation Program goals. Every program must be jointly submitted by a lead applicant, like Alyssa explained, and at least one partner organization, and a hospital must be included as either the lead or a partner. On logistics, questions were due by June 18th. We're waiting for those Q&As to be posted. And completed applications are due by 4 p.m. Eastern on July 14th, sent by email. Next slide, please. Here's a checklist that we're including that you can use as a practical final review before you submit your application. Confirm your lead applicant eligibility, that you have qualifying partner organizations and a hospital. Verify your county coverage is eligible first. That's always helpful, and that your planning and implementation budget is in order, and that you've defined clear outcomes and metrics. Make sure you've included a sustainability plan, that you've attached all required attachments, and that you've completed and assigned the final attestation. If every box here is checked, you should be in good shape to submit your final application. Next slide, please. So I'll hand it back to Alyssa at this point to kind of wrap us up and give you some key takeaways from our presentation today.
Thanks, Brian. Appreciate it. So biggest takeaway, right? The funding supports rural health integration and transformation. You know, I think that's the biggest takeaway. You heard it from our host this afternoon as well. Collaboration is a must. It is required. So they're really going to want to see that you're demonstrating that you understand who your partners are within your county and how you're going to work with them. You know, $500,000 is allowable to plan and figure out what those implementation activities are going to be. And those requests can total up to 3 million. I did the math, and if every county applied and they were equally given dollars, it was still over $1 million a county, which is amazing. So think about, how you want to build out that budget and how much you want to request. And as of right now, unless anything changes on the application, the applications are due July 14th. So we did include the links in the presentation. I'm sure we can share this out to everyone afterwards as well, but included the link to the application, to the website where I think the answers are going to be posted for that. And so more than anything too, we included our contact information as well. I know we're going to pause just to see if there's any questions, but PCG has supported doing these studies, developing rates to make viable reimbursement and make these programs sustainable. We have already submitted in other states applications to work with providers on these different projects. So definitely reach out to us if you have any questions. But we'll pause here and just see if any have come through.
All right, Alyssa, I want to thank you and Brian for the excellent, right to the point slide deck. Appreciate the brevity of the presentation. Get right to it. It was great. I did want to make sure that folks had your contact information and whether PCG is available. There it is right there. Folks, thank you very much for putting that on there. So you could reach out to PCG we'll get the slides. So everyone that's on here, Sarah and I will make sure that we circulate this to all the rural counties that are eligible, so they'll have the slide deck. But is PCG able to, one of the questions is to assist the county in filing for the grant? Is that something that you can do for a rural county?
So we have in other states. That was one of the questions we asked DOH is, like in other states, we're eligible to be a consultant like that.
So you can be a consultant. Okay, good.
Mm-hmm.
So I'll leave
I did want to confirm that with DOH too. So that is a question that we have, but to my knowledge, and other states have said yes already to that. So we believe yes, we're able to support.
I'm going to have I have one other question. Two questions, and then I'm going to turn it over to Alex. There are a few questions in the queue. Please, folks, we have 30 minutes here, 25 minutes. We can go through all the questions you might have, but there's 3 in there right now. I'll have Alex go through that. But before we do that, just a quick clarification from NYSAC. Christina asks, can the county be the lead applicant? I'll pause there.
Yes.
Answer is yes. Or does the county have to be a partner to a public hospital?
Nope, it can be the other way around. So the county can be the lead applicant as long as at least one of the hospital or the hospital within your county is a partner.
Okay, so it could be the other way around. The county can be the lead with the partner being the hospital. Okay, yeah. I've got one question, then I'll turn it over to Alex. Brian, can you go back and Alyssa to the slide going through prioritized grant applications and walk through what the state might be looking for here or the federal government, wherever this funding is coming from, with these priorities that the county should be aware of for their applications. And then after this question, I'll turn it back to Alex to go through some of the questions that have come in, zip codes and things like that. So if you can find that slide.
I think I'm on it as long as y'all can see it. So they did say they would prioritize funding for counties that address maternity services, maternal child health, behavioral health integration, as well as substance use disorder prevention.
Okay, maternity services, maternal child health. We do this, so this is good. Can't supplement, right? No, it can supplement, shouldn't supplant. I always get those two words messed up.
Yeah.
Okay, we do that right now. So this would be in addition to behavioral health integration and substance use disorder prevention. Perhaps the counties can use the opioid addiction grant money that we got from our lawsuits that we sued, that we could use the opioid money and use this as wraparound funds for that purpose. Okay, I'll turn it over to Alex. She'll run through a few questions and hopefully get your answers. And then we'll give the last word to Sarah Ravenhall at NYSAC at the end of the session. So, Alex, I'll turn it over to you.
Great. Thank you, Stephen. And thank you again to Alyssa and Brian for that great presentation. I think these slides will be a really great resource for our members to have, as well as the recording. So we'll make sure we share that with our members, as Stephen said, after the webinar. We've got some questions in the chat. Please submit any other questions you may have. We also received some questions in advance of the webinar that I'll get to. The first question I want to ask from the chat is if there is a listing of specific zip codes within each county that could be included. Alyssa or Brian, do you have an answer to that one?
I do not. And I'm not sure, Livia, what when you say specific zip codes, what you're looking for. I know that the eligible counties that they listed in the application are are here, and I mean your county's on here. So I definitely think you're eligible. I didn't see anything in the application as well as like asking for zip code information on things. I think when you take a look at who the lead applicant is, there's an attestation that is requiring that, you know, you're a not-for-profit and certifying all that information. And then it does want you to list your partner organizations and I believe their addresses. But I'm not sure if that answers your question, but I hope it does.
I thought at some point there had been a listing that I had seen, and of course I can't find it, so maybe I dreamt it. I have no idea. But you know, I'm only raising that because while there are several of these counties on this list are, you know, purely rural counties, some of our counties are kind of mixed population. So we have rural areas and some areas that are decidedly urban, right? And so I would imagine that if this is a rural transformation grant, we probably shouldn't be including the areas of our counties that are urban, but I also don't know that for a fact.
Well, that's a good question. The one thing I would say, because we've seen this with some of the other states too, is that and counties that like have both urban and rural areas, is that I still think about like how that care coordination would work. Would somebody potentially in a rural area of your county receive services or virtual or like some type of, you know, community paramedicine or mobile integrated services from an area that's more urban? And how are you coordinating that service if that's where the, you know, where that hospital or primary care ends up being if it's not in the rural part of your community? So I don't remember seeing anything yet about the application or zip codes, but I do think, you know, we'll definitely comb through and we can definitely, you know, be on the lookout when the answers to the questions, you know, if maybe someone asks that as part of the application. But I would think about it from that lens too. How will those areas within your county that are more urban support the rural? Because I think that's probably where the state is going with this too. Because yeah, I see, you know, I see Schenectady and Rensselaer on here too, and a couple others that have some more urban populations. But how are you going to support those rural communities within your county?
All right, thank you.
Of course.
Great. Thank you for the question. Another question we received was about hospitals. So if counties are supporting a hospital's application, are they allowed to support multiple hospital applications or just one?
So I think this gets back to the part that Brian brought up, that like if your county has multiple hospitals in it, I think you need to think about like how you want to coordinate it, because if it's one county, or right, like those are I think that's how they're anticipating the applications coming through. And so if you have multiple hospitals, is one of them a lead applicant and then the others are partners? But you can't, like they said, if you do multiple applications, they either are going to tell you during the evaluation process that you need to coordinate, or they could reduce the funding. And so I would just think about it, like what makes the most sense in terms of your collaboration, and whether you're working with multiple hospitals within your county, or are you working with multiple counties and one hospital, if that hospital is providing, services to multiple counties. But they did say very clearly in the evaluation that they might lower the funding if they receive multiple applications from one county.
Thank you. I think that's clarifying. Another question from Dr. Santiago Rosado from Dutchess County in the chat. She asks if you have any suggestions as to whether it would be preferable from a logistics standpoint to have a nonprofit be the lead applicant. And she notes that as a public agency with a lot of restrictions, they can be at a disadvantage managing the money, especially with a tight timeline to spend it. So do you have any thoughts or suggestions on that?
It's a good question. I would go back to, and I think we have it in here, right? They're saying lead applicants should be those institutions that possess strong institutional capacity, the deep community ties, and a record of commitment to serving their constituents. I would also think about, like less on the restriction side, but like who, potentially has the most resources to be able to monitor this, right? This comes with a lot of reporting. When you talk about managing the money, cutting the checks, organizing all of that, who's the strongest within your community to potentially do that? If the hospital has more experience with grants than the county does, or vice versa, maybe that's the strongest applicant. But it didn't say that either or, I don't think either or would be a hindrance in terms of like the state evaluating, these grants.
Thank you. We'll go to another question that just popped in the chat. One of our members from Washington County is confused on the eligibility requirements. The attestation states that the entity must be registered as a 501c3 or a municipal hospital, and local health departments are not either of these. So can you please clarify?
Yeah, we can get clarification from that too. I think that what we were saying here is like the hospital has to be either a municipal hospital or a not-for-profit, but I believe that the lead applicant can be a local county health department. But we can circle back on that and just clarify that in case the way we presented this is unclear. I just want to double check the application requirements again on that one for you.
That would be great. Thank you, Alyssa. I see Peter's got his hand raised. Peter, did you want to jump in with a question?
Not really a question, just a statement. Local health departments are regulated as in Article 28, like a hospital. So that may be the connection point there.
Yeah, thank you.
Another question we received in advance of the webinar is about the role that local health departments can play if the county is not the lead applicant. So what, Alyssa and Brian, do you think meaningful county participation looks like for the purposes of a competitive application if the county is not the lead applicant?
He came off mute. You want to take that one, Brian?
Yeah, I was going to jump in. I previously worked for a state health department, and knowing that the capacity in some of the local health departments isn't always the same, especially rural areas. Data is access to data and the relationships with maybe the state to be able to pull down some existing data that covers not just that one county, but maybe adjoining counties. That population health data is probably a very good way that a county health department or local health department can get involved. Birth and death data is usually a great source. Any sort of research that's been done at that county level on previous grants or previous projects, all of that experience and that access to the countywide information could be I think could be a huge partner, helpful partnership that they could add to those applications.
Yeah, just like with a lot of other federal grants, we know that the state has to report back to CMS and the federal government as well on these funds. So that's why they're going to be I think on the reporting side, the data side, just like Brian emphasized, is going to be, key on this. And I know the state said they're going to release what that looks like in terms of what is needed. But hopefully they come out with that soon too, because, if there's new reports or new data that you need to start tracking, getting that in place while they're, evaluating or you get those awards is going to be hugely important too. Because they're going to want you to start tracking it like once those awards are made.
Those are some great suggestions. Thank you both. So for counties that may not have a municipal hospital or a large rural health network, what type of organizations do you think are best positioned to serve as a lead applicant?
Let me go back to this again too, just so we can take a look at that. But, I think it also comes down to like, what are the needs of your county? Like what are you focusing on in terms of improving that population health? I think other areas that can be strong, obviously the local health departments. I think federally qualified health centers, if you have those in your area, right? So they're serving usually in rural, areas or underserved areas. And so what are those primary needs that they're addressing when people come in, to their centers? I think sometimes the local EMS departments can have a great, could be a strong, partner or lead applicant as well. They provide, and we've seen this as well, they're starting to do community paramedicine programs, mobile integrated health. So they're at the front line. A lot of times they're the first person to get there before someone even decides to go to a primary care, right? They call 911. And sometimes, they're the ones that are there first. And a lot of the experience we've seen too, sometimes they serve as primary care in areas if they can't get to a hospital or there isn't a hospital in the area, they are the primary care. And so I would focus on, and Brian, definitely add if there's anything I'm missing here, but definitely think about too, like what are the needs of your population? I think different counties are focusing on different things based on the populations that they have and they serve. And so, who's best eligible or able to support that if you don't have a hospital is how I would probably approach it too.
Yeah, exactly. Like Alyssa said, and like it says here on the slide, the multi-county approach is it's an option, right? If there's no hospital in one county, or if there's low resources in one county, nothing prevents an adjoining county or another county from, pulling together to encapsulate that county. And the application even says that funding levels may reflect that geographic scope. So potentially, we don't know exactly, but potentially there could be more funding if 2 or 3 counties or regional type application was put in. All great questions to ask.
That is a great segue. Thank you, Brian, because my next question was going to be if multi-county applications are more competitive, or do you think that applicants should focus on the geography that best reflects the partnerships that they already have? Any thoughts on that?
That's hard to say.
I know, I was like, it's hard to say. We're not the evaluators. I would say I would look at it as like, what are you trying to achieve in this year one? And do you think, based on what you're currently doing or what you could do with other counties, like, like how are you going to measure those outcomes of quality? And if, multiple counties apply and that you'll achieve, or you think you'll achieve better outcomes, then I would say go for the multi-county application, right? Like they don't want you to use the funding for existing programs, right? They've been very clear that it's got to be new and innovative ideas. And so, if you're working already in collaboration with some of your other county partners to best serve your population as well as maybe theirs, right? If there's crossover, I think that could look, favorable. But again, we can't speak to the department and exactly how they're going to apply, but I would think about like the quality and what they're focusing on, right? Like the key metrics, the key requirements, and like those quality outcomes that they're looking to see from the applicants.
Great. So our next question from the chat, is there guidance on a regional approach where we can share that each county's needs are met and money is properly allocated to each area? And Broome County says, for example, they understand that one option in their area is a 10-county approach, which is rather large.
Yeah, that definitely is large. I would also, like I'm assuming, like all of you have done, I know community needs assessments usually get done on, like a 3-year basis, you're reviewing those. So I think, that seems large, but also if you have the lead applicant or whoever is going to be in charge of keeping that consortia together, I definitely think it's doable. I would just think about like, do you have the resources, the staff to be able to do that, and track all of the quality metrics that are needed, tracking the funding, planning all of those meetings and coordination.
Thank you. So we've got an
Yeah.
update from our team. Dave Lucas shared regarding the question with zip codes that he didn't see anything from the State Department of Health application regarding zip codes, but counties have these federal information processing standards numbers that act as a standardized numeric identifier developed by the federal government to uniquely identify geographic areas like states and counties. And those numbers for eligible counties were what was included in the DOH application. So I'm not sure if that is clarifying, but I wanted to share. We'll take 1 or 2 more questions and then we'll wrap ahead of 3 o'clock. Another question we received is related to the implementation projects. So what types of activities are most likely to be viewed as achievable within the short time frame?
I think I'm going backwards. Sorry, Brian, let me get back to that slide.
No, while you're going there, I would start with sustainability. Through almost every application and guidance that we've seen federally for this program, this Rural Health Transformation Program, sustainability over time is key. And I think states will be held to that same accountability level. So making sure that the plans and the sub-grantees here follow along with that sustainability and the ability to keep those programs alive and well, and not just shut down once the funding stops, would be one of mine.
Yeah, I also think if there's certain areas that you want to focus on in a study, a feasibility study or community needs assessment hasn't been done in a while, focusing on that in year 1 and getting that done could be a really good one. I also think around, like, to Brian's point, talking about sustainability, thinking about how are you going to reimburse for some of these services if it's not something that currently could be reimbursed. Like I know that treatment in place for EMS departments the rates just came out about a month ago, and they're going to be able to retroactively bill, which is huge, right? Which means EMS doesn't have to go to the ER to receive reimbursement. They can do that treatment in place and then bring that person to another destination. But also thinking about, are there other potential services in terms of sustainability that maybe are not currently being reimbursed at the Medicaid level, but you can negotiate with insurers in your region or with the hospitals and say, okay, like we're going to transport these people to a primary care or, a lower acuity, like an urgent care center. And for bringing that person there versus the hospital, we would like to receive X amount of dollars. And so you can come up with that type of financial modeling as well to create that sustainability over time too. I think the other one that like jumps out to me too is workforce development. While the funding cannot be used to directly pay for clinician salaries, identifying people that you might need going forward to help sustain this work, I think would be huge too. And right, thinking about your future budget planning and thinking about that.
So the question I wanted to end on is, what should counties do right now, immediately after this webinar, to put themselves in the strongest position before the deadline?
I've got one idea here that I was about to throw in. I would say crack open the state's application. Every state put an application in to CMS to receive their funding. And the New York State Rural Health Transformation Program application project narrative is probably a really good place to start. Just as these programs that will be funded will be required to submit back to the state is required to submit back to the federal government. So the closer that each applicant here can align with the state's plan, the easier it will be for the state and the more likely they will be to get continued funding, I think, ongoing. Alyssa, anything in addition to that?
Yeah, I would definitely take a look. The application and the requirements of the application are available on the state's website. We also included it as part of the presentation. I would definitely be on the lookout for that Q&A when it comes out. But I would also say if you have not started to talk to your community partners yet, or not thinking about how to apply for this, I would also start there, because the one thing that we've seen and we think is coming from the federal government is that if states do not expend all these dollars, how are they going to apply for the same amount or more if they want more next year? You know, I think the states are going to have to be able to demonstrate that they expended the dollars, that it's working, that they're using it. And so, you know, if they aren't able to expend the 71 million that's allocated just for this, how are they going to be able to get it next year and allow you all to apply for additional funds? So I think that's the biggest thing too, is like, think about how you can use this and start to think about how to apply, but definitely be in touch with your community partners.
Absolutely. So I want to thank Alyssa and Brian from PCG for walking us through this opportunity, for taking the time to answer our members' questions and explain the application process, the eligibility requirements, and then some next steps. I think they offered some really strong recommendations for what your counties can do after this to make your application as competitive and as strong as possible. I also want to thank Governor Hochul, of course, and State Health Commissioner McDonald for their leadership and commitment to strengthening rural healthcare across New York State. And thank you to our partners at NYSAC for joining us today, for their continued leadership and for their collaboration with our local health departments across New York. Today's webinar and the slides will be made available on our website at nysac.org/webinars. Before I end this, I do want to turn back to NYSAC for the final word, and I want to thank our members again for their time today. Christina, do we have you on from NYSAC to offer some closing remarks?
Thank you, Alex, so much. We really appreciate this opportunity, particularly to engage just from local health departments across other partners within the counties. I think we all want to make sure that these are being maximized to help communities. I kind of want to put in a plug for the work of our local health departments and your community hospitals this year. And you referenced this, both Brian and Alyssa, but this year, hospitals had to submit community service plans. Local health departments did community health assessments, and they are just in the process of finalizing community health improvement plans. And so they are in a very good position, both with their data and also with interventions that they've identified where they can, rather than needing to do a community needs assessment, you know, there may be that data there and those needs and potential interventions identified in some of these priority areas under this grant that are things that funding under this project could support. So take advantage of that opportunity and the work that's already been done in your counties by both your local health departments and your hospitals, and use that data and those potential interventions to be ready to do this short turnaround on this application. And we really appreciate PCG and NYSAC for putting this together. I know our members are very interested in seeing how they can maximize and improve access to care and services for their communities. So really appreciate it.
Thank you, Chrissy. And thank you again to all of our members for taking the time to join us today. More importantly, thank you for your continued work on behalf of New Yorkers. We appreciate everything you do for your communities, and we look forward to continuing to support you in this work. Take care, everyone.